Heart failure is when the heart is unable to pump blood effectively to meet the body's demand. Around 5% of the population has heart failure after the age of 50, and it is especially more common among men. If left untreated, heart failure can cause death within 2 to 3 years from the first symptoms. However, with effective treatment, a patient's lifespan and quality of life can be significantly improved. That's why we will discuss the 5 earliest signs of heart failure, the most common causes, diagnosis, treatment, and prognosis. The first and most noticeable symptom of heart failure is shortness of breath. Initially, it occurs during physical activity, but people commonly ignore it or attribute it to age. Over time, it becomes more prominent even with small physical exertion, such as walking uphill or going upstairs. Eventually, shortness of breath becomes so severe that a person feels it even during the smallest physical activity or at rest. Shortness of breath happens because in heart failure, the heart is unable to pump blood effectively, causing some blood to back up into the pulmonary veins. This increases pressure in the pulmonary capillaries, causing fluid to leak into the lungs, which makes it harder to breathe. Fatigue is the second most common leading sign of heart failure. It happens because less blood is supplied to the muscles, resulting in less energy and chronic tiredness. Swelling, or edema, is the third most common symptom. It usually starts in the legs and gradually spreads to other parts of the body. This occurs because the heart's pumping function is reduced, increasing pressure in the veins. Fluid leaks from small blood vessels and accumulates in the legs first due to gravity, and then in other parts of the body, including the stomach, ascites, and the lungs, pulmonary edema. Pulmonary edema usually worsens when a person lies down, leading to orthopnea, which is difficulty breathing while lying down. The fourth most common symptom is a rapid or irregular heartbeat sensation, known as palpitations. When the heart is working abnormally, it causes irregular electrical activities and heart rhythm problems, known as arrhythmias. The most common scenario is a rapid heartbeat, known as tachycardia. The fifth most common symptom is a cough or wheezing, especially a chronic unexplained cough. It occurs because fluid leaks into the lungs, causing breathing difficulty and coughing. This cough can be accompanied by coughing up pink-colored mucus. The cough exacerbates when a person lies down, which is why they may need to use several pillows to elevate their body and feel more comfortable. Heart failure develops slowly and gradually in 90% of cases. At first, a person may have risk factors for heart failure but no physical symptoms during ordinary physical activities. This is called the first class of heart failure and is the mildest form. The most common risk factors for heart failure include coronary artery disease, hypertension, arrhythmias, and structural heart diseases. When a person starts to experience symptoms during daily physical activities like walking upstairs or walking uphill, it is called second-class heart failure. The symptoms can include palpitations, dyspnea, or angina. If a person has symptoms during even the smallest and mildest everyday physical activities, it is considered third-class heart failure. However, such patients feel better at rest. The last or fourth class is when there are heart failure symptoms even at rest, and it is considered the most severe stage of heart failure. Now let's discuss the diagnostic criteria and the most suitable ways to diagnose heart failure. First, we consider physical symptoms like shortness of breath, swelling and edema, crackles during breathing because of fluid accumulation in the lungs, and cough. In more severe cases, jugular vein distension can occur due to venous pooling. On an echocardiogram, the ejection fraction should be measured. This indicates the percentage of blood the heart pumps out from its ventricle. If this pumped blood is less than 40%, it is considered heart failure. Sometimes, this ejection fraction is preserved, but the heart is unable to relax and fill with blood, which is called diastolic dysfunction. In this case, it is also considered heart failure. Heart size changes as well. In many cases, the heart chambers are enlarged, which is called dilation. On the electrocardiogram, abnormal heart rhythms are most commonly detected, such as atrial fibrillation, which can exacerbate heart failure. B-type natriuretic peptide is measured in the blood. If it is elevated, it strongly suggests heart failure because it is released in response to increased pressure on heart walls, which is common during heart failure. To summarize, heart failure is indicated if a patient has difficulty breathing, neck vein distension, lung crackles, and heart enlargement. If there is fluid in the lungs and the person has swelling of the legs and abdomen, there is also fluid in the pleural cavity, and the patient has tachycardia, fast heart rate. This combination of symptoms and signs creates a clinical picture of heart failure. Now let's explain heart failure treatment. If there is first-class heart failure or no significant symptoms but the person has heart disease, a low-sodium diet is important, with less than 2.3 grams of sodium daily. Regular physical activity, at least 30 minutes per day, weight management, and smoking cessation are also essential. ACE inhibitors or ARBs are used because they relax blood vessels, lower blood pressure, reduce the workload on the heart, and improve survival. Beta blockers slow the heart rate, reduce blood pressure, improve heart function, and increase survival. If there is fluid retention, then diuretics are used. Diuretics help eliminate excess fluid and reduce swelling, edema. The effectiveness and prognosis of first-class heart failure are excellent with adequate treatment. Most patients will live a normal lifespan. In the case of second-class heart failure, the treatment is the same as in the first class, and if it is not enough, aldosterone antagonists are added. Because aldosterone antagonists have several actions including lowering blood pressure, decrease fluid retention, and decrease fibrosis, which is an important factor developing of heart failure. The prognosis for second-class heart failure is also good. Many patients can continue most normal activities with slight limitations. For third-class heart failure, the treatment is the same as in the first two classes, and digoxin may be added. Digoxin helps strengthen the force of the heart muscles' contractions and slows the heart rate, which can improve symptoms. Cardiac resynchronization therapy, CRT, is used for patients with significant dysynchrony. It helps the heart's lower chambers beat in a more synchronized manner, improving the efficiency of ventricular contractions. Additionally, an implantable cardioverter defibrillator, ICD, is used for patients at risk of sudden cardiac death. Patients with third-class heart failure have a reduced lifespan, but treatment still significantly improves symptoms and quality of life. The treatment for fourth-class heart failure is very stringent. It is difficult to manage such heart failure. Patients are advised to have strict bed rest and maximum fluid and sodium restrictions. High-dose diuretics are used to manage severe swelling, along with 4 medications such as inotropes in advanced cases and continuous infusion of medications. A heart transplant may be considered if the patient is eligible. The prognosis of fourth-class heart failure is poor. Patients usually live from several months to several years with aggressive treatment.